My father had a heart attack and he died in the 70s, but as a great sportsman, it didn't stop him from getting a heart attack. He was a smoker as well, chain smoker, and he paid his price for these things. So I knew I had to take precautions.
People more and more recognise the risk factors, the ones they can change and the ones they can't. Family history is a very important risk factor, but there are acquired risk factors, cholesterol, smoking, lifestyle, lack of exercise, and things that people mightn't even know they had, like diabetes and high blood pressure.
High blood pressure is still very common. Perhaps up to a third of the adult community have got high blood pressure, so it's still probably the most common treatable condition that we can encounter. And even for those people that have got a heart problem, treating high blood pressure is a very important way of preventing that heart condition getting worse. But the cornerstone really of treatment of high blood pressure is lifestyle. So things like controlling your weight, exercising regularly, important diet, low salt diet, and just trying to reduce your alcohol if you drink excessively, not to smoke. All those other sort of factors can affect high blood pressure. So if someone's diagnosed with high blood pressure, one of the first things we do is trying to get on top of their risk factors, trying to get them to maintain a healthy weight, exercise half an hour every day for walking if they can, and try and reduce their stress levels and maintain a healthy diet. That'd be the keys really to controlling blood pressure. But essentially it's a genetic basis, and blood pressure is really controlled by the kidneys. So your body's ability to regulate your blood pressure is controlled by the salt and water balance in your kidneys, but it's also affected by other things like your heartbeat and your blood vessel tone. So the drugs we use to control high blood pressure affect all those causes, if you like, to try and control the blood pressure.
Certainly a drug, this group of drugs is not something that we need people to be afraid of. We do need them to be alert and to be wary of any new medication that they're started on, but certainly they've been used in a wide variety of people.
Other sort of things that we talk about include cholesterol. In particular, the total cholesterol should be below 4.0 for someone with heart disease. The LDL or bad cholesterol should be below 2.0, and we like the good cholesterol to be higher and above 1.0 to try and reduce your risk for heart disease.
Basically what we need to remember is that with cholesterol, about 20% or so comes from our diet. Now, cholesterol is produced at our liver, and cholesterol is an essential part of our body. It's an ingredient of the cells of our body, and is used to produce a lot of structures in our body. Many of us genetically produce more cholesterol than we need, and therefore to retain that balance, or to return that balance, a number of us, particularly those that have cardiac history, need a little extra, as well as maintaining our diet and our exercise. We will need an agent that is going to work at our liver to control that cholesterol production and get that balance back.
A little bit of a myth is that if we eat a lot of dietary cholesterol, our blood cholesterol is going to go up. And actually, it's the saturated fat, which comes from animals, that raises our blood cholesterol level. So the conversion rate from dietary cholesterol to blood cholesterol isn't necessarily as efficient as it is with saturated fat. So keeping saturated fat low is probably the most important thing we can do for our blood cholesterol. So if we're thinking about eggs, they're quite high in cholesterol. However, that conversion rate means that they're not necessarily going to raise our blood cholesterol by a large amount. So the National Heart Foundation recommends up to 6 eggs per week. Now, you may not want to eat them all in one day, but we are able to eat foods that are higher in cholesterol for that reason.
Everyone should have their cholesterol checked at least every 5 years. So if you haven't had a checkup for a long time, that would be a simple thing to do. If you're on medication, or if you have associated conditions like diabetes, you'll need a checkup much more regularly, perhaps every 6 or 12 months.
Stress as a causative factor has been shown that people that have got high levels of stress or are depressed are more likely to suffer a cardiac event down the track. So I think stress in itself is not a cause of heart disease, but it's a contributing factor because it does cause your blood pressure to be increased. You're more likely to drink alcohol more or smoke some cigarettes more if you're feeling stressed.
Essentially, no smoking is what we're aiming for with people with heart disease, because this is one of the most reversible factors that we can alter for adjusting your risk for a future heart attack. We also like to control your blood sugar, which should be below 5.5 fasting. And we also try and look at other variables such as activity levels, where you should be walking for at least half an hour every day, and trying to keep your weight in the healthy weight range. Having a waist circumference is below the threshold for healthy males and females, which happens to be 94 centimetres in males and 80 centimetres in females, has also been shown to reduce your risk of heart disease, because the fat that builds up around the middle of your tummy is associated with build-up of plaque in the arteries in your heart. So that's another important variable that we can control.
Alcohol is a risk factor too. Too much alcohol can be a problem, and we usually recommend that you have 2 standard drinks a day for men and 1 standard drink a day for women. They say that there are antioxidants in red wine, which is beneficial, but once we drink too much, the benefits of those are outweighed by the risks of alcohol.
There was some heart disease in the family. My father had had a small heart attack, but he hadn't had a bypass or anything like that, because I think in the 70s they weren't so common. And so he just soldiered on, and he only lasted 3 years.
Non-modifiable cardiac risk factors are essentially those things that have happened to us or that we were born with that we can't actually do anything about. Now, the typical ones that we talk about are age, and when we can't stop the clock, and basically the older you are, the more risk you have of getting heart disease, unfortunately. If you're male, you tend to get heart disease at an earlier age than females, but females do catch up to males a bit after the menopause, and certainly having an early menopause is a risk factor for females. Family history is one of the most important risk factors for heart disease, and that's one of the first questions I ask my patients when they come and see me. If you have a family history of both parents having heart disease, then you are at a much greater increased risk for heart disease than those people that don't have family history. And it's particularly important in these families that we watch their risk factors pretty aggressively to try and reduce the risk of getting heart disease.